Do you actually have sciatica? Because as a physical therapist who has treated thousands of people with low back and leg pain, I've found that many who believe they have sciatica have pain that originates from a completely different source altogether. In this video, we'll explore a common condition that mimics sciatica, and I'm going to show you 3 quick ways to determine if your pain is truly sciatic in nature. I will also cover my preferred ways to quickly treat this issue, so stick around until the end. Hey everybody, welcome back for another episode of Physio Show, where we answer all of your rehab-related questions. The sciatic nerve is the largest nerve in your body, about the thickness of your finger, and when it gets irritated, you know it. There is no pain quite like nerve pain. It's intense and easy to set off, making it a bit tricky to manage. People will usually experience shooting pain down the leg, sometimes along with numbness and tingling, which can start in the low back and extend all the way down to the foot. Typically, sciatica most commonly occurs from the lower back when the nerves are compressed due to a herniated disc or arthritis. And while this certainly can happen, it's not the only source of pain that travels down the legs. The most common cause of sciatic-like leg pain may actually originate from the muscles. The muscles in the hip area are a common cause of pain in the leg. More specifically, the culprits tend to be 3 muscles, which can act out individually or as a trio. These include the glute medius, the glute minimus, and piriformis muscles. These 3 muscles are common causes of what could be called pseudo-sciatica, pain that feels like sciatica but is not nerve pain. But why does this happen? Well, it can all stem from trigger points, otherwise known as muscle knots, which are tight bands of muscle that develop for a number of reasons. This can be caused by various factors, but the most common of which are deconditioning due to a sedentary lifestyle and prolonged sitting, or on the flip side, overuse due to repetitive activities or poor posture, leading to muscle strains. Both result in trigger points, which cause localized pain and discomfort. But here's where it gets interesting. These trigger points can also refer pain down the leg, mimicking the symptoms of sciatica. Now you might be wondering, if the muscle lives all the way along the side of the hip, then how come I feel pain down the leg? Well, that's a good question, and it has to do with what we call referred pain. Referred pain occurs when a person feels pain in an area of the body that is different from the actual source of the symptoms. This phenomenon typically happens because sensory nerves from different parts of the body converge on the same neural pathways in the spinal cord and brain. It's the very same reason people have left arm pain during a heart attack. Now, how do you know if it's sciatica or if it's referred pain from the muscles? Well, as a physical therapist, we utilize several simple assessments to determine this, some of which you can perform on your own. So I'm going to show you. One such test is called a slump test. To perform this test, sit on a chair with your back straight and your feet flat on the ground. Then slump forward and bend your neck down, followed by bending one knee and straightening out the other. If this movement reproduces your leg pain or worsens your symptoms, it could indicate true sciatica that may be coming from the lower back. Another test you can try is repeated extension in lying. This test aims to assess whether repetitive backward movements of your spine alleviate or aggravate your leg symptoms. Lie on your stomach and prop yourself up on your hands like you're performing a cobra pose. Gently arch your back and hold this position for 5 seconds and then return to the starting position and repeat this for 10 repetitions. If this motion either relieves or worsens your leg pain or tingling sensations, it suggests that the origin of your symptoms may be in your spine rather than in your hip muscles. If neither the slump test nor the repeated extension in lying changes your leg symptoms, it's possible that your symptoms are stemming from the muscles in your hip. To confirm this hypothesis, you can perform a simple palpation test by poking around your butt muscles. Lightly press and poke around to see if you encounter any tender or sensitive spots. Now, these muscles are deep, so you may have to apply a bit of pressure. Tender spots in the hip muscles may indicate the presence of trigger points or muscle tension that could be contributing to your symptoms, especially if these tender areas reproduce your leg symptoms when you press on them. If this is the case, your symptoms are likely stemming from those muscles and not the sciatic nerve. Now, before you get concerned, this is a good thing. You would rather have muscle trigger points as the primary issue than the sciatic nerve. Muscle pain is much easier to manage. And if you're curious on how to make these painful trigger points go away, well, check out this next video where we cover effective techniques to help you alleviate pain and restore muscle health. Well, I hope you enjoyed this episode of Physio Show. Make sure to hit that like button and subscribe to the channel so you can learn more about your body, how it works, and what it needs to keep moving.